Good morning, everyone, and welcome. Welcome to the OU Health Definitive Agreement signing ceremony. This is a day we have all been looking forward to for some time, and we are so pleased that you're here to share it with us. We hope you've been enjoying the beautiful music presented by the University of Oklahoma's Brass Quintet, conducted by Dr. Shanti Simon, Dr. Brian Wolf, and Associate Dean Brian Britt. We appreciate them joining us this morning. For those of you that don't know me, I'm Jennifer Schultz. I'm the Senior Vice President of Marketing and External Relations for OU Health. And today we are going to witness history in the making. Joseph Harroz Jr., President of the University of Oklahoma, and G. Rainey Williams Jr., Board Chair of University Hospitals Authority and Trust, will be signing 4 documents to officially merge the University of Oklahoma College of Medicine clinical practice and the hospitals known as OU Medicine Incorporated to become a unified, comprehensive academics health system, the first of its kind in Oklahoma. To kick off this ceremonial event, please join me in welcoming President Harroz.
Thank you all. This is one of those days, often the word historic is overused, but it is not today. This is a day that is decades in the making. We all know that this coming together is an incredibly special moment. And I want to do a few introductions. We could introduce everyone here. I will make these introductions and ask that you hold your applause, no matter how badly you want to applaud for each one of them individually. I'll ask each of them to stand, and then we'll recognize them collectively, but please realize this is only a sampling of those who have been a critical part of this. And the first one is dressed, I've worked with him so long now that we're actually dressed nearly identically. While I'll go through just the rest of the names, I do want to say that when Mike Sammis, who was a dear friend of all of ours, passed, and one individual stood up and took the leadership role that he wasn't expecting to take and has been absolutely selfless in all of this. And the first introduction is that of Rainey Williams, Board Chair of UHAT. This can last a really long time, or you can follow the directions. There's an easy way and a hard way. If you would, please stand. That's right. And no applause. Then I'll go to the next name. Again, all of these, I could put so many superlatives next to them. I'll just go through them. Randy Dow, CEO of UHAT. Secretary Kevin Corbett, the Oklahoma Secretary of Health. Not present, but with his grandkids, with a more important engagement, Regent Mike Cawley. Chip Keating has so many titles, I'll just say Chip Keating, who is on the OU Med Inc. Board of Directors. Dr. Jason Sanders, Senior Vice President and Provost of the OU Health Sciences Center. Dr. John Zubialdi, Executive Dean of the College of Medicine. Ken Rode, Chief Financial Officer for OU Health Sciences Center. Anil Galahali, General Counsel for OU. Ann Barnes, Senior Associate Dean for Administration and Finance for the OU College of Medicine. Jennifer Schultz, who you've already had on up here once, Senior Vice President of Marketing and External Relations. Then I want to list these other groups before we do the round of applause. Again, there are so many. Our partners at ECG, who were critical to this, Chris Collins, Dan Harrison, all of our physician leaders who have been critical to this, the executive leadership teams across the OU Health Sciences Center, OU Medicine Inc., and OU Health Physicians. All right, so why is this moment so important? I was just on the phone earlier with Senator Lankford talking about it, and I once again tried to explain why this is so important, and it took like 6 minutes and was relatively inartful. So to me, as we break down why this is a historic moment, it's important to think about the context of what a state can do for its people. Right? What can a state do for its people? And it really breaks down to 3 areas. And I was just reading recently Dr. Gary Raskob's book that he did along with Gene Rainbolt. And it spoke about 3 things. It spoke about the health of a population, the health of a state, and it talks about the educational attainment of a state. And it talks about the economic opportunity that is available in a state. And then you think about the missions that we have. So across the hospital, across the university, the critical role that UHAT has played in this. right? It's about patient care, right? The health of that population. Right? What are our 3 missions that we have at the university? Right? How do we change lives? And it's all around taking care of the health, education, and creating economic opportunity. So those are the 3 keys. When you think about why today is so important, it's because all of those are unlocked whenever you have a true academic health system. Right? Those 3 goals for the populations of a state, the 3 missions that we have as a university, the goals across all of it, can only be unlocked if you have this really complicated thing that loses everyone when you talk about a fully integrated, comprehensive academic health system. Right? It's a mouthful. But what is it really? And so let's take just a step back and think about our history and what's led us to this moment, this idea of being fully integrated, the idea of delivering the best. Right? I think about my father, who was a 1955 graduate from the OU College of Medicine. When I was very young, I asked him about OU, and he talked about how he went to OU Medical School, but he was a private practicing OBGYN in Oklahoma City. And he told me this, and I'll never forget it. He said, you know what, the absolute best physicians and healthcare professionals are at OU. So when you're really sick, you have to go to OU. But don't go there unless you're really sick. And I've thought about that for some 45 years. Right? Why would that be? Right? Why would that be? Then you think about the progression. Just 25 years ago, the hospital was going broke. Hospitals across the country were all going broke. So you had to find a lifeline to keep it going, and we did that. And we entered into a transaction with then Columbia HCA. But as healthcare moved forward, all of the resources financially went to the hospital, and those were exported to their shareholders in Tennessee and across the country, not invested in the other missions that exist here beyond the patient care itself. February of 2018, there was a historic moment where OUMI was created. The nonprofit was created. You had put this together, and we were independent from a for-profit hospital. That was an important moment, but it wasn't the end. We still weren't all brought together. And there was a moment in time when you think about the patient experience, right? The best providers, but why couldn't you get the best experience? Well, we had 21 separate departments where you receive clinical care. Their own billing, their own collecting, right? Their own mechanisms, plus a separate hospital. We had 4 governing boards that were involved in decision-making, completely separate strategies that at times interrelated and times didn't. So if you think about it, why is this moment so historic? Right? Why is this moment so important? This moment is so important because for the first time, we're all coming together in a singular enterprise. We're able to provide patient care across the continuum, not in 25 separate units, not with separate governing boards, not with separate strategies, but one laser-focused on the best possible treatment for our patients that are done unlike in any other hospital in this state, infused with research, with 7 colleges, and those that their training and the expertise they bring all brought to bear for the care of that patient. And the resources that go into that not being poured into out-of-state shareholders, but being poured back into our missions of research and training. We train 80% of the healthcare professionals in this state. To be healthier, we have to have more. We have to do more. To grow economic opportunity in this state, biotech, biomedical, all things health-related and economic flow from the research enterprise. Life-saving research that patients can only get here, that go through clinical trials, and you know our numbers around that, are developed here and then are exported to all of our state, across the country, and around the world. And so when we talk about why is this so important, the answer is because unless it's all together with a singular strategy, with a singular focus, serving all 3 missions, we cannot truly benefit our state, the health of our state, the education of our state, and the economic opportunity of our state. So this is that. This is that historic moment. And it is easy to understand, sometimes difficult to articulate, and it is a Herculean lift. I was talking with Dr. Gesseroon a minute ago, right? We have been in the same structure for so long that even when we know what the best systems have and that we must change, it is difficult to change. This is not easy. It has not been easy, and it will not be easy. But it is the right path. This puts us at the starting line. This gives us the chance. This puts us in a position to do what we do, which is to change lives, right? To heal our patients, to create life-changing research, to train the providers of tomorrow to provide a level of care never before known, to bring all 7 colleges to bear. So this is an incredible moment. There is so much more to do, but for the first time in decades, we have right now, with the signing that I hope Rainey also signs, because that would be awkward if he didn't. But with this signing, we will form for the first time, for the very first time, a true academic health center that can do all of those things. Do all of those things that we've dedicated our professional careers to. I'm honored to be a part of it. There are so many individuals who have been a part of this. It will take all of us to move this forward. So I'd ask that as I end, that we all do a round of applause for each other and encouragement for the future. Thank you all very much.
Thank you, President Harroz. Next, I am pleased to have asked Dr. John Zubialdi to join us. Dr. Zubialdi is the Executive Dean of the OU College of Medicine. Dr. Zubialdi.
Thank you, Jennifer. Thank you, President Harroz. What a truly exciting day for the state of Oklahoma, the OU College of Medicine, and most importantly, the marvelous patients that we serve. Our focus in creating OU Health, as you have heard, has been to consistently place our patients first in everything that we do. That goal is being further enhanced today by this merger. By unifying the key elements of our health system into one enterprise, we're creating a seamless experience for patients between clinics, centers, and hospitals. This also brings together all of our healthcare providers across the enterprise and really helps them to be fully aligned with the patient journey across the continuum of their care. That continuum, as you have heard, is only possible at a comprehensive academic health system. The model that we are creating in this merger is enjoyed by the healthiest citizens, or the citizens of the healthiest states in the United States of America. It is what Oklahoma has long needed to bring the highest quality, research-driven healthcare and innovation to our state. Our goal has and will continue to be that we use all of the means available to us in order to improve the health of all Oklahomans. Also, to assure that Oklahomans don't have to leave the state in order to find the very best care that they need and deserve in their most needful and desperate times. The new physician and provider practice created by this merger, known as OU Health Partners, Inc., is the largest provider group in the state of Oklahoma. It provides the most specialty and subspecialty expertise for both adults and children that's available anywhere in the state. It is also unique in that our new organizational management structure has physician leaders working directly side by side with operational and nursing leadership to make the key decisions and ensure excellence in patient care, patient satisfaction, quality, and safety. This merger is also an exciting advancement for our research enterprise. Research at OU Health is growing fast and will grow even faster. This growth brings new knowledge and innovations that help us to solve the most difficult challenges, the most difficult disease challenges, and find ways that literally help us to transform the delivery of healthcare. This kind of transformative work can only happen in a system that enhances the collaboration between scientists, physicians, and patients. It's this synergy of talent that transforms discoveries that are found and started in the laboratory and transforms them literally into advanced treatments that are then delivered at the bedside. It's that same synergy that takes those discoveries and disseminates them across our communities and our nations to, quite frankly, revolutionize healthcare. Being a comprehensive, fully integrated academic health system also allows us to retain our best and brightest trainees in Oklahoma. Simply put, it's here that our learners see future possibilities and want to be a part of the solutions for Oklahoma. This also allows us to recruit top physicians, physician scientists, and researchers from across the country to practice with us here at OU Health. Such talent then seals our ability to assure that no Oklahoman will ever have to go outside of the state in order to find and receive the best possible care that they need and that they deserve. Lastly, this new comprehensive enterprise can rapidly accelerate our ability to grow the education pipeline for new health professionals. As we all know, this is greatly needed in our state, and it's no secret that our need in Oklahoma is very high. This includes doctors, APPs, nurses, dentists, pharmacists, physical therapists, and so many others. OU Health provides the very medium in which interdisciplinary, team-based healthcare can flourish. This type of care is the future of health, and I'm so very proud to say that today, the future of healthcare and future of health is here. Ultimately, the greatest motivation for our merger is indeed the people of Oklahoma. Our unification efforts are now and always will be to provide our patients with ever-increasing access to the latest treatments, the nation's most talented providers, and to seamless patient care across everything that we do. So thank you all for being a part of that. So appreciate you.
Thank you, Dr. Zubialdi. Now please join me in welcoming Mr. Rainey Williams, Chair of the University Hospitals Authority and Trust and Co-Chair of the OU Health Board of Directors.
Thank you. Thank you, Jennifer. Thank you, President Harris and Dean Zubialdi, for your comments. I want to begin by thinking about Mike Samus. President Harris mentioned he was a volunteer leader on this campus for, I think, 27 years and saw it through everything that President Harris talked about, and really was one of the architects of everything. And he would be very proud to see where we are in this step. So just great memories of Mike. Today is a long-awaited achievement for our enterprise, and one that the University Hospitals Authority and Trust is proud to be a part of. For more than 20 years, UHAT has been proud to support educational enhancements, research and healthcare advancements, and critical capital improvement projects on the campus of the OU Health Sciences Center. Today's official signing of the agreement embodies the mission of UHAT to be a catalyst for medical excellence, to support medical education and research, and to assure quality health care for all Oklahomans. Today is a pivotal moment in that mission. As OU Health hospitals and OU Health physicians merge into one enterprise, we are moving to a single CEO and one governing board. This will allow OU Health to continue to lead the effort to improve the health of all Oklahomans.
Excellent, thank you. We are going to sign some documents. So now, as President Harroz and Mr. Williams get ready to sign documents and take their pens, I'd like to ask some of our leaders to join the stage. So Dr. Jason Sanders, Senior Vice President and Provost of OU Health Sciences Center, co-chair of the OU Health Board of Directors, if you can join us, along with Randy Dowell, CEO of the University Hospitals Authority and Trust. I see we have some members of the OU Health Senior Leadership Transition Team. If you're able to come up and join us, we'd sure love to have you join us. And also there's some deans of our 7 colleges that are also here today, if you'd like to join us as well. Just come up and gather around while we go through and start signing documents. Don't worry, you'll notice that they have commemorative pens. You're going to have a commemorative pen delivered to you in the next couple of weeks as a part of this moment. Make sure we get our Chief Legal Officer for OU Health up here to make sure we have everything lined around. Excellent. Gather around. This is a gathering. It's very exciting. Excellent. Are we ready? Okay. The first document. The first document is the integration and purchase agreement between the university and OU Health. It describes the restructuring of the clinical enterprise to form OU Health, the transferring of assets and employees from OU to OU Health, representations, warranties, and other commitments of the parties and liabilities pre- and post-closing. Excellent. Ladies and gentlemen, the integration and purchase agreement. All right. Next, President Harroz and Mr. Williams will sign the master affiliation agreement between the university and OU Health. This document describes the parties' close affiliation and desire to align strategic, operational, and financial interests in support of their respective patient care, teaching, and research activities. It provides the contractual framework for the affiliation and identifies other contracts and schedules that support the affiliation and the parties' commitments. Excellent. The master affiliation agreement. Excellent. The third document is the academic health system agreement between the university and OU Health. This document amends and restates the former academic affiliation agreement, states the guiding principles supporting the parties' cooperative actions and collaborative efforts leading to the successful integration of the university's academic programs with the OU Health facilities. It recognizes that clinical and translational research is an important part of the university's mission and the success of an academic health system, and will be conducted collaboratively between the university and OU Health, and establishes the Academic Health System Council, comprised of administrative, education, and research leaders from the university and OU Health. This document has an additional signature from Dr. John Zubialdi, the Executive Dean of the College of Medicine. And that's the Academic Health System Agreement. The final document, the Master Clinical Services Agreement. President Harroz and Mr. Williams will be signing a document that describes the terms and conditions pursuant to which OU Health Partners will provide the professional medical services of its practitioners to patients of the health system sites, and medical leadership and administrative services for the benefit of OU Health and its affiliates, and includes the compensation to be paid by OU Health for such services. And that is the Master Clinical Services Agreement. Thank you, President Harris, Mr. Williams, and Dean Zubialdi. That's our final document. Welcome to OU Health. Thank you all for joining and helping us celebrate this momentous occasion. Of course, the celebration's just beginning. We've invited our employees to join us for a reception. That's going to happen over the course of the afternoon, so please stay and enjoy.